Hello everyone. Here this is our patient. She has a grade 1 CA endometrial type, endometrial carcinoma, and here we have started our robotic surgery. And generally I use scissor in my right hand, bipolar in my left hand, and cardiac in number one arm. So here already I have injected the indocyanine green dye into the cervix, or a green dye, and here I have just started to find it out the sentinel node. And this is like first step is just to cut the round ligament to enter the pelvic side wall. So as we all know, sentinel node is the first node where there is the highest chance to spread the cancer cells from the primary site of the tumor. So in the uterus, the pathway of lymphatic channel generally goes in the two way, one to the pelvic node and pelvic node side, and second will be along the ureter towards the directly para-aortic node sides. And this is like a firefly system of the robotic XI system. And in the firefly, as we can see, there is a completely green dye which generally emits because of the infrared rays which goes to the indocyanine green molecule. And this is really very meticulous technique where we did not to cut any blood vessel and any lymphatic channel. Here you can see the ureter is moving, and track also has started to see the spread inside the parametrium. You can see, and the track starting from that parametrium to the sentinel node, we have started to dissect it. It's just along the ureter going towards the pelvic side wall, and we are just tracing that track more and more upwards. And on my right there is a extrailiac artery pulsating, and here you can see there is minute bleeding. So generally we will try to avoid any bleeding so that our field of vision will be very clear and we can see the proper sentinel node track and sentinel node. Here you can see like we have found it out the sentinel node over the external iliac vessel right side, and I have started it to dissect. So on and off we will just convert firefly system to normal vision so that we can see the track also and normal anatomy also. But yeah, when we will use to much more with the experience, then we can do surgery even in the firefly mode also without disturbing other structure. But yeah, again this is the normal vision, and just because of some of the bleeding I have just converted to normal vision. Generally for the beginner I suggest try to use more normal vision rather than using the firefly system. Here you can see like we have completely removed that node, and even in the firefly system there is no leftover in the pelvic space. This node we have taken inside the glow bag, and just purpose is just not to do any spillage. And now I am coming to the right side of the obturator fossa, and just to make sure there is no other sentinel node track or I am not missing the first sentinel node. And here we can see there is no track is going inside the obturator fossa on the right side. Yes. Now coming to the left side. Left side already I have cut the round ligament and already entered the pelvic side wall, and already started dissecting the left side of the sentinel tract. Generally we used to push a dye at 3 and 9 o'clock of the cervix, 0.5% indocyanine green dye, and that molecule emits the green light by the infrared rays. And generally our firefly system in the robotic camera will emit the infrared rays. Here we can see the beautiful track coming from the parametria going towards the extrailiac vessels. And again I am just trying to see is there any other sentinel tract is there or not inside the obturator fossa, but yeah, I didn't get it. Here again I'm confirming the ureter before going and dissecting the sentinel node track so that I can prevent the injury to the ureter. Yeah, we got it. Here you can see ureter with sentinel node, afferent tract, efferent tract, and efferent tract is going more above that. And here also we got it at internal iliac artery level, just below the bifurcation of the common iliac, and I have cut the sentinel node, and again I'll just put it in the glow bag to avoid any spillage of the cancer cells, if any. And yeah, again make sure, again just opening the pelvic side wall more in the obturator spaces, just to ensure there is no other sentinel node and sentinel node track, and I'm not missing anything. Yeah, nothing is there, and no dye is there. So this is very skilled technique, and because of this we can prevent a lymphedema, lymphocyl, and that percentage of complication is around less than 1% because of this technique, and the recovery is very beautiful. Within 24 hours of the surgery we can discharge the patient without any complication with the same quality of life. Thank you.